Hey everybody, Dr. Dan McClyman here. I'm so excited that you're here with us. Welcome to Beacon of Life Chiropractic. My wife and I, Dr. Megan and I, are the founders of the practice, and we have a mission in our community to reach as many people and families as we can with health and healing from the inside out. And what we know is that our bodies are designed perfectly. We're created to heal. Health is our default, not sickness. And so if our body is not healthy, if we're not functioning correctly and we have sickness and disease, there's always a cause to it. And so our mission is to be able to understand and address the root cause of these issues so that you can live the life that you were created to live. Do the things that you love to do with those that you love to do them with. And so as far as what we're going to do right now, what the word doctor means in Latin is teacher. And not a whole lot of doctors are doing much teaching anymore, but what I'm going to do is share with you a few things that you need to understand in terms of assessments and Xrays and the technique that we specialize in. And some of the most frequently asked questions that I get, we're going to cover them right now. And then our team's going to take you back individually and go over your specific findings and recommendations, and we can get you adjusted as well. And so when we look at our healthcare system today, it's really more of a sick care system. I think we could all agree with that we have this mentality that typically for most people in America says, if it ain't broke, don't fix it. If I feel fine, I'm healthy. And then if it hurts bad enough and it gets in the way of my life bad enough, then eventually maybe I'll do something about it. And we typically at that point manage and treat and suppress symptoms. We don't get to the cause of it. Does that sound familiar? I get it. I understand that as well. We push through things, but here's something I want you to think about. Not to be morbid or dramatic, but the top two things that kill the most people in this country are cancer and heart disease. 5 people out of 6 cause of death is cancer or heart disease. So can someone have stage 4 cancer, an advanced stage of cancer, and not feel any symptoms leading up to it? Happens all the time, right? We probably all know someone or multiple people in this room that's dealt with cancer and or heart disease. I think we could all agree with that. Myself included, my dad's dad, my pop, he was in Battle of the Bulge in World War II. He died at 56 of cancer before I was born, and I actually never got to meet him. And some of my greatest joys in my life are my boys. I have 3 boys. My wife and I have 3 little guys. Is seeing them play with my dad and my mom and their grandparents. And so if we base our health just on do I feel good or not, or maybe I have a terrible migraine and high blood pressure, but the medication takes care of it, we're really missing the boat. 80% of the time, the first major sign of heart disease is a heart attack or a stroke. It's not pain, it's not a headache. So the point here is that before we get to crisis, we need to look at how the body's functioning, okay? So there's one way that this happens, and I want to share that with you. And when you look at what runs the body, we all know that it's the master control system. It's the brain. And the brain does that through the spinal cord and the nervous system, okay? And really simply put, I give people this acronym, ADIO. It's on the wall here in the practice, Adio. And what it means is above, down, inside, out. Real simple, okay? Above, down, messages from the brain like a fire hose of life first go down through your brainstem, down the spinal cord, and then from the inside out the nerve roots, telling the heart to beat, lungs to breathe, food to digest, all your organs to do their job. I can't feel my thyroid or my pancreas, but that's the way that those organs are controlled, okay? So if you think about Superman, if you know Christopher Reeve, he used to play Superman on TV, he had an accident, right, where he fell off a horse, if you remember, and he didn't misalign the top bone in his neck. He didn't misalign that bone. He completely broke it. And when he broke that bone right there, one bone broken, he was completely paralyzed. He had an iron lung to breathe, life support, colostomy bag. None of his organs worked either. So the difference between what you're going to see on your assessments and your X-rays and what happened with Chris Reeve is that he completely fractured the bone. And what we're going to talk about are misalignments in those bones, compressing the brainstem, creating interference. It's called a subluxation, and what that means is bones out of alignment, creating interference, like a dam in the river, okay? So the extreme example, Superman, we're not talking about that, but we do want to illustrate how when he broke this bone, the brain couldn't talk down and out to the rest of the body, okay? So some of you might have seen that it looks like a daycare in here sometimes. We see a lot of families, a lot of children, a lot of pregnant moms, and everybody in between, folks well up into their 90s and everyone in between. Who has a brain and spinal cord and nervous system running their body? Exactly, we all do. Do you know what the number one cause is that misaligns that top bone in the neck when we come into this world? It's exactly right. It's the birth process, the twisting and pulling of the birth process. Medical research time and time again has shown that over 90% of the time that bone, the one that Superman broke, doesn't get broken, but it gets misaligned or subluxated over 90% of the time with a quote-unquote natural birth, normal birth, no intervention. And if you know much about the birth community and the birth culture in our society today, there's an awful lot of intervention. C-section delivery, induction, forceps, vacuum, Pitocin, epidurals, all these things. And there's a time and a place for those things at certain times, but they're dramatically overutilized. They're drastically overutilized. And what happens is we interfere with this natural process and we create interference right from day one. So we do separate workshops, just so you know, about that topic, about childbirth and pregnancy and raising healthy kids, autism, ADHD, and sensory processing issues. We do workshops on these separate topics, so I'm not going to go into an extreme amount of detail on that, but I want you to know that chiropractic's not about just back pain. Not to minimize, if you got back pain, I want to help you. Obviously, we want to do that. But chiropractic is about one thing, 3 words: remove the interference. Remove the interference in the brain's ability to communicate with the body and get out of the way. We make specific corrections to reduce that nerve interference, and we get out of the way and let your body do what it was created to do. You know, we don't see babies with migraine headaches. We see kids with colic, with ear infections, with difficulty latching, infantile reflux, constipation, left uncorrected. Kids don't grow out of ear infections, they grow into allergies, they grow into food sensitivities, they grow into sensory processing challenges, developmental delays, bedwetting, things like that, asthma, okay? So our body's created perfectly, and that's very simply put. Again, you know, what we do is remove the interference, and the body's a perfect creation, and it does the work. So one thing I want you to know is time and repetition. Talked a little bit about babies just now. If we can take care of that interference when a child is 3 months old, 3 years old, it's going to take a little bit of work, a little bit of time and repetition. If we start to work on things when somebody's 43, more time, more repetition. Somebody's 83, you get the idea, more time and repetition. The body, it's a stinker that way in a sense, in that it takes time to change. It doesn't want to change. To lose 30 pounds, for braces to correct the structure of teeth, you know, God forbid you break your wrist, it's going to take time for those bones to heal. But the body does the work. You cut your finger, God forbid, you know, Band-Aid on your finger. The Band-Aid doesn't heal your finger, but the body, it produces that new tissue, new layers of tissue, scab, scar tissue. Before you even know it, you don't even know that there was ever even a cut there. The body will have healed it. So that's the ability of the body to do the healing that we work with. But time and repetition, again, you know, as far as getting correction, actually addressing the cause of the issues, we're not just going to do temporary relief, you know, come when it hurts, you know, sounds good, Bill, all right, you know, that looks great, come back when it hurts you again. We look deeper. We look, as you know, with the technology that we do the assessments. I'm going to share a couple of those things. And some of the X-rays, how long has it been there? How much damage and how much neurological interference is there for us to determine what kind of recommendations you need for correction? So I just wanted you to know that. It's, again, you know, principle. It takes time and repetition. So I want to show you a picture of what a subluxation looks like. And a subluxation, instead of the bones being lined up correctly, protecting the spinal cord and nerve system, a subluxation is when one or more of the spinal bones is misaligned and it's creating nerve interference or neurological interference. So 2 things, bone out of alignment, creating interference to the nerve system. Now, you might have heard of the discs and disc degeneration. Those are the blue parts in between. And the disc, serves a special function. The disc is mainly a spacer to keep this bone away from that bone so the nerves can come out from in between. It's like a marshmallow between two blocks of wood. So when we have proper alignment, we have proper motion, okay? And the motion of those bones acts like a pump to keep the disc hydrated and healthy. Just like the hinges on a door, if those door hinges are misaligned, how's the door going to move? It's stiff, creaky, right? Yes, exactly. It's not going to move the way that it's supposed to. So when the bones are misaligned, same thing. They don't move correctly. They get stuck, for lack of a better term. And then the discs dehydrate, they degenerate. They call that osteoarthritis, degenerative disc disease. But this is like a car out of alignment. You keep driving a car out of alignment, it's going to wear the tires down, right? More quickly, more rapidly, unevenly. When that happens, the nervous system, spinal cord and nerve system becomes compressed and irritated like we talked about. So I don't really care about the bones and the discs as much as I care about what they protect. So I want you to keep that in mind. Now, one thing you might remember from your first visit is that we talked about how these nerves that come off the spinal cord are what they call mixed nerve roots. So a small portion, 8%, is used for sensation, pain, okay? If that part, that 8%, the very small part of the nerve that's for pain is irritated, you're going to feel it. However, the larger majority, the largest portion, the outermost 92% of these nerves is all for function. It's all function. Again, as far as your liver, your kidneys, your adrenal glands, your pancreas, your thyroid, stuff you can't feel, the same nerves are controlling them. So that leads me to ask the question, how do we know if we have nerve interference? If you don't feel it, if it's not on the pain portion, the sensory portion, how do we know if there's nerve interference? Well, what we do is I tell people we test, we don't guess. To see is to know and not to see is to guess, all right? So we use technology, and there's a few different kinds of technology that we use, but basically with the gist of this, you want to see an even, symmetrical, if you have your assessments there in front of you, a copy of them, you want to see a nice, even bell-shaped curve, clear throughout. Now, the technology reads for a number of things, but mainly what we're looking for is where is there nerve interference and how severe is it, okay? And then we can track your progress. We do these assessments before you start care, as you know, and then we'll track your progress as you're going throughout care to make sure that you're feeling better, which you're going to be able to tell us, but we're going to be able to show you how the function of the body is improving as well. Remember, cancer, heart disease, okay, immune issues, digestive issues, chronic illness. It's not always a pain thing, it's a function thing. So we measure function as well as how you're feeling throughout your care. All right? Okay, now, so let's shift gears for a second. I want to explain a few things about the X-rays, okay? And then I'm going to touch on the technique and we're going to get wrapped up and get you rolling. The thing I want you to know about your X-rays, unless you're pregnant or etc., we didn't take X-rays, I still want you to understand this, but what you're going to see shortly, the side view of the neck. When we look at the side view of the neck facing that way, you need to see a nice C-shaped curve in the neck. They call it the arc of life. Reason is three things. We got a 12-pound bowling ball up here, okay? You need a shock absorber underneath of it. The weight of the head, about 12 pounds, you need a shock absorber. The other thing, number two, is that what runs right behind there is your brainstem. Remember the Superman bone? That's this one right here that he broke. Over 90% of births, quote unquote, natural, no assistance or intervention. That bone gets subluxated, misaligns, compresses on the brainstem and the cranial nerves and so forth. The vagus nerve, if you've heard of that, the 10th cranial nerve, very important. So the second reason the curve is important is protect the spinal cord and the brainstem. The third reason is because what runs right through there around that spinal cord is what they call the cerebrospinal fluid, okay, the CSF. That fluid takes nutrients and oxygen to the brain and toxins back down and out of the brain. So if you think of that like plumbing, goes up and around and back down and throughout. So you need that nice curve in there. What happens is that oftentimes what we see is that that curve has gone straight and or in the reverse direction, okay? So number one, we're holding the bowling ball out here all day, 12 pounds in front of us. Doc, my neck, my shoulders, they're stiff, numbness, tingling, carpal tunnel, that kind of stuff. Thyroid issues. First thing I look at, how's the curve in the neck? Because the brunt of the stress is placed down here in the lower part of the neck, middle part of the neck. That's right where the thyroid's controlled, down lower, the heart and the lungs, okay? Headaches, migraines, dizziness, vertigo, that kind of stuff. So the first discs to wear out that we talked about when we don't have a curve is the lower neck, almost 100% of the time because the weight's out front and that's where bears the stress. So that makes sense. Those nerves come down to the hands and the fingers like we talked about, grip strength, numbness, tingling, carpal tunnel, that kind of thing. The second thing that happens, as you can imagine, think about the spinal cord and the brainstem nice and loose and relaxed here like they should be with that proper curve. That's like a rubber band at rest, okay? Imagine that when that curve goes forward, it's like you're stretching the rubber band, okay? Spinal cord attaches at the top and the bottom. So if the curve is forward and or reversed, it's like we're stretching that spinal cord and brainstem, okay? Literally our lifeline. So that's the second thing you want to know. The third and final thing you want to know about that is that cerebrospinal fluid that brings the nutrients and oxygen to the brain and toxins down and out, that becomes compressed. And I'm going to show you an MRI here in a second so you can see that. Dr. Bragg, medical doctor, pretty sharp cat. He and his team did some work on this. He won the Nobel Prize for their work on this. And what he found was that when you lose the curve in the neck, like I just described, it puts pathological tension or stretching between 5 and 7 centimeters on the spinal cord. They found that that reduces your lung capacity 30%, just like that, okay? You know, asthma, breathing issues, COPD, sleep apnea, those sorts of things. First thing I look at, TMJ and jaw pain. First thing I look at, how's the curve in the neck, okay? So there's a lot that we could go into with that, but I just want you to know that that's one of the most important things that we can share with you for the reasons we discussed. How common is it? Well, in 1980, 2 people out of 10 had a straight neck. 8 folks out of 10, pretty good curve. Fast forward to today, okay? Fast forward to today, over 40 years later, instead of 2 out of 10, anybody have a guess how many people out of 10? Well, if you look at 100 sets of X-rays, on average, 97 out of 100, straight or reverse. Over 9 out of 10. Why? What's everybody doing that's causing the curve to go right out of their neck? Exactly. I'm sure you can imagine phones, video games, computers, tablets, things like that. Literally taking the curve out. I have 7-year-old kids who come in straight and reverse curve in their neck at 7 years old. Okay? So, again, you know, why do we take care of kids and families and everybody in between? Because everybody's got a nervous system. All the folks, every single person in our lives that we know has a nervous system running their body, not just the people with back pain or headaches or chronic illness. So if we have nerve interference, remove the interference. That's what we do, okay? Now, just real quickly, I want you to see that this time person's looking this way, proper curve in the neck. You can see the white on either side of that spinal cord. The white on either side, that's the fluid, okay? The cerebrospinal fluid. Looks good there, proper curve. The black spaces are healthy discs. That's what we want to see, okay? So keep in mind when our team shows you your X-rays here in a few minutes, understand that that's what we're looking for. Now, over time, we lose the curve in a lot of scenarios, okay? So phase 1 is we lose the curve. Look how that spinal cord, can you see how that spinal cord looks stretched? Remember the rubber band, it's stretched. And right there and right there, you don't see the white on the back side of the cord. That's where the spinal cord's being compressed. Is that person healthy or sick? Exactly, they're a sick person. They're sick, meaning that do they have symptoms or not? Maybe yes, maybe no. But they're sick in terms of there's dysfunction in their body. Now, do we want to wait till they start to have migraine headaches and high blood pressure to do anything about it? Or if we do the assessments and we see the interference and the loss of curve, do we want to work on it from a preventative, proactive standpoint? That's healthcare, okay? And that's what we want to do. But again, you know, as far as teaching, not a whole lot of folks are teaching about this. So I want you to know why we're doing what we're doing. Now, left uncorrected over time, like a car out of alignment, continues to wear and tear. So phase 2, the discs start to degenerate. That's about 30, 40 years of degeneration. You can see the cord being compressed there, okay? Phase 3, left uncorrected from there, is 40 to 60 years of wear and tear. That's where the points start to form. That's what they call bone spurs, okay? And you can see how compressed the cord is at multiple levels. Here's what I want you to know. Progress, not perfection. You don't need to have perfect X-rays for you to get well. However, if this is going on and we do nothing, it doesn't stay the same. We're either going to get better and move towards better health or away from better health. So again, as far as your care, don't think of, okay, oh man, I got so, that's like, oh, what am I going to do? No, it doesn't need to get perfect again. We want to slow it from getting worse, stabilize it, get as much proper motion and alignment in there as we can, and recover as much as that healthy nerve function as we can, as much as possible, okay? Now, if you look at somebody from the back to the front, right through here, left hip and right hip, like we're standing behind this person. Want to be nice and level, just like the foundation on a house. Spine straight up and down. A lot of the times, like the curve in the neck going forward, one hip tilts up higher than the other one, like what you see here. Left higher than right, puts a curve off to the side. Low back pain, sciatica, numbness, tingling, foot drop, weakness, restless legs, yes. But remember that your body, your nervous system is like a fuse box, okay? So you have the different appliances in your home, your air conditioner, your dishwasher, your microwave, heater, whatever it is. The spinal cord and these spinal bones are like the fuses in the fuse box. They give power supply to the appliances, to the organs. So if things are fouled up with the alignment, for example, in the low back, very commonly we see things like bedwetting in kids, getting up 3-4 times a night to go to the bathroom in adults. We see incontinence, we see infertility, extensive cramping, menopausal symptoms. We see a lot of lower digestive tract issues like Crohn's disease. We have a number of testimonials with things like Crohn's and diverticulitis, ulcerative colitis, things like that. Okay, people have major surgeries and are major medications, colostomy bags, all this kind of stuff because nobody's told them that if you have issues here and in the neck, it's affecting those organs, and those organs are not functioning correctly. So as we remove the interference over time, as far as healing, we see those things recover, okay? In the middle part of the back, the appliances or the organs, for example, are the heart, the lungs, the upper digestive tract. So mid-back pain, yes, but things like acid reflux, indigestion, okay, cramping after meals, that kind of thing, asthma and breathing issues, high and low blood pressure, irregular heartbeats, arrhythmias. We see those things. And then to the top of the neck, the head and the sinuses, headaches and migraines, ear infections, most common thing we see in kids. Number one reason for visits to the pediatrician, ear infections. Do you think if their atlas is subluxated, it creates some plumbing problems with the fluid draining? Absolutely, okay? Dizziness and vertigo. We've had people have to change their prescription for their glasses and contacts because their vision improves, sense of smell comes back. So again, as far as with what your body's capable of, it's not me, it's not my team. We don't heal you. We remove the interference, and your body does the work. Your body does the work, and it's capable of healing. Now, again, as far as how much time and repetition it takes for your body to heal, we don't know. Are there limitations to how much healing can happen? Sure there are. But progress, not perfection. We don't ever stand still. You're always moving towards better health or away from better health. So keep that in mind when we look at our X-rays here, okay? Now, y'all have probably heard of scoliosis. We can go into more detail with this, but this is Elena, just to give you an idea here. Elena, tilted hips, right hip's higher than left, 2 curves in her spine. Elena, when she first came for care, she couldn't walk, balance, stand still, run. She wet the bed every night, and she had severe asthma, needed a rescue inhaler multiple times a day, okay? Over here, this is 12 months later, 12 months of corrective care with the torque release technique. Almost perfectly level hips, almost perfectly straight up and down. That's considered to be a medical miracle, not supposed to be able to happen. What's amazing and why I love sharing this story so much is because at this point in time, she could do all those things. She could stand still and balance. She could walk. She could run. She wet the bed no more, and her asthma was about 70% improved. She didn't need her rescue inhaler as much, okay? Dramatic, life-changing scenario. But here's where it gets good. If anybody has a guess, does anybody know how old Elena was here when she first started? 7 years old. 7. She's a little girl. And obviously 8 years old here a year later. What does it look like for a 7-year-old who can't do all that stuff? I mean, you guys know how kids are, how they can be. You know, maybe she gets picked on, left out, made fun of at school, can't participate in recess or in sports. The emotional stress of growing up, not being able to do those things and how that scenario can be, the medications and their side effects. Okay, you know, embarrassed to sleep over a friend's house because she wets the bed. The financial strain, you know, on mom and dad and the family as far as all the medications and care that was involved versus here, completely changed the trajectory of her life growing up. That's why we do what we do. Because I know that when people walk in the front door, they don't come in here because they have a headache or because they have back pain. It's because either currently or in the future they're concerned that those issues with their health are going to get in the way of doing what they love to do and or what they need to do. Taking care of their family, playing with their kids, their grandkids, enjoying time together, performing at work, you know, not coming home and having to check out for the rest of the day in a dark room and, you know, not be with the family and engage because you have a blinding migraine, you know. When it gets in the way of our life, we do something about it. So time and repetition, that's 12 months of corrective care. Okay, and so everybody's different with what they need, but I do want to share with you the technique briefly. There's no twisting, cracking, or popping. Okay, it's very gentle and very specific. What we talked about earlier briefly was how the spinal cord attaches at the top of the neck and the lower back and hips. Nothing in the middle, but the cord, if you've heard of an epidural, I'm sure the epidural, an epidural pierces the dura. The dura is the outermost layer of the meninges, the outermost covering around the spinal cord, like the skin around the spinal cord. The dura attaches to a few bones up top and a few bones down here in the low back and hips. So when the bones are fouled up, it stretches the spinal cord, it stretches the dura. There's a lot of things that happen with that. That puts the body in what we call the sympathetic dominant mode. We talk about that in our Perfect Storm workshop about neurodevelopmental challenges. But the sympathetic dominant mode, the fight or flight stress response, okay? So when we're on the gas pedal, we can't be on the brake pedal. You're either in one or the other. So the brake pedal is the rest and digest, calm, growth and development, relaxation mode. If our spinal cord, if our dura is stretched, physiologically our body goes into stress, fight or flight, gas pedal mode. Blood pressure goes up, pupils dilate, blood goes from the organs and the viscera to the arms and the legs to fight or run get out of there. Because we don't need to think about digesting our breakfast if we're about to become breakfast, running from a tiger, for example. That's the change that happens when the dura is stretched. So our technique, we work gently and specifically at the top and the bottom, just like if you have the two ends of a guitar string, just by turning the one end of a guitar string. By turning that one end, you're going to change the tone of the whole cord. So basically, we work at top and bottom to take that stretching and tension off the spinal cord and then get the heck out of the way and let the body do what the body was created to do. And so that's how we do that. It's very gentle, and you'll see that. It's very specific, but at the end of the day, the thing that matters is results, okay? And you can see this double scoliosis here. We don't get bones and scoliosis, for example, to correct like that by manhandling, popping and cracking and jumping off the top ropes and cracking and popping bones from one position to another, okay? It doesn't work like that. Among everything else that we discuss that the nerves control, they also control the muscles. So if the nerves are interfered with, if there's strain and irritation with the nerves, the muscles that they go to are going to compensate, tighten, spasm. So I love massage. I think it's fantastic. I recommend it. However, you can massage the muscles till the cows come home do PT, stretching, strengthening, exercising, whatever you want to do, but until you get the proper power supply back to those muscles, they're going to continue to dysfunction. However, when you clear out that nerve interference, the muscles can come back to more symmetry from side to side and relax, come back to more symmetry, and then the bones can improve their structure and function. Okay? So that's the long and the short of what I want you to understand about that. Here's the thing that just to conclude here, we talked about the birth process, so I just want to hit a couple things before we wrap up, and those things are time and money. They're the two biggest hurdles for people taking care of their health, okay? So time between your first visit and today right now, a little bit more to cover, okay? It takes a little bit longer, and I appreciate your commitment to the process and understanding, again, as far as what's going on, how we got here, and what's the plan to help to get you well and keep you well. But beyond that, the adjustments don't take long. To do an adjustment, 2 minutes, 3 minutes, maybe. The way that we do it, we use the Achilles reflex in the heel area, and through that reflex, just like if you were to hit underneath the knee for the patellar tendon and kicks the leg out, they hit under the knee with the reflex hammer, we do a similar thing with the feet. And what that does is it tests the reflex, it shows us where's the most tension on the spinal cord, and that reflex matures fully in 3 seconds, and our docs can explain it more to you. But just so you know, as far as timing, it takes 3 seconds for that reflex to mature. So we need to move fairly quickly to analyze that correctly and make the appropriate corrections. Doesn't take long. We're not going to sit there and stand there with you for 15, 20 minutes and discuss, all different kind of things, because our mission is to help as many people as we can. Now, if you have questions, concerns, you want to sit down and discuss something, again, as far as making that happen and creating the time for it, by all means, let us know, let our teams know. But when it comes to adjusting, we're very focused on removing that interference and letting your body do the healing. Time and repetition. If your body's been that way for 35 years, it's going to take a little bit more work in the beginning, a little bit more time and repetition, and as we start to get improvement, less and less from there. So the visits from here on out, and the adjustments, they don't take long. As far as the money part of things, I don't love talking about money. In fact, it's the least favorite thing of mine to talk about in the process, but it's part of it. So again, as far as having that work out, I get it. So insurance doesn't cover everything. Insurance covers some stuff, okay? They typically cover a portion of care. Here's what I want you to know. Whatever insurance benefits you have that we can honor, we're going to do our best to do that, save as much as we can. But what I'm very adamant about is not allowing your insurance to dictate your care. Based on your assessments, your health history, your Xrays, etc., those findings, we're going to have recommendations for care for you, for correction, not just temporary relief. Come back when it hurts, or come back when it hurts, headache, or my insurance does 10 more in January. We don't do that. We lovingly refer folks to other folks who will do that kind of care if they're looking for temporary relief. Because if I know that you need pressure off your brainstem, if you need corrective work with more time and repetition, I couldn't sleep at night in all integrity if I didn't recommend appropriate care, okay? So if you need this much for correction, insurance helps with this much, we do our best to honor it. And then for whatever they don't help with, we have a discount program where we legally discount non-insurance care. We can do that, and we do that to help to offset the cost of corrective care for the reasons that we discussed. Families. My wife and I decided before we opened this practice that we're never going to have a family, for example, of 5 come in, say, and 2 or 3 of them sit on the bench and 2 or 3 of them get adjusted because of money. So what we do is like a cap or like a cutoff fee system. So for multiple family members, families of 2 or more per the household, anything above and beyond that cap, we reduce the cost per visit to keep it at the cap to help with that. So again, as far as helping you, helping your family, we work our best to do that. Now, you have a hope sheet in front of you, and what the hope sheet is for is that as I was going through some of the different things that maybe you hadn't thought of before, maybe different people, family members, coworkers, loved ones popped into your head. If they're local, let us know. That's what the hope sheet's for. We'll reach out to them and offer them a complimentary assessment and consultation to see if they have nerve interference. What they do with that is up to them, but our heart and our mission as part of our community service is to get as many people checked as possible. Let them know what's going on. It might be an answer to their prayers, to what they've been struggling with. If they're not local, let us know. We'll do our best to find a doc in their area, okay? The last thing I want you guys to know is this, is that when it comes down to your health, it's a team process. We're not going to just dictate your care and say good luck with that. It's a team process. So we're going to work with you. We're going to monitor your progress. We're going to reassess your goals and where you're progressing with that. We want you to feel comfortable, to be at home. We want to earn your trust. We believe in relationships built on trust. So any and all questions that you have, please let us know as we go. The team's going to be up here in just a second, and they'll get you taken back and go over your particular findings and recommendations. And I just want to let you know that I'm so excited and honored to be a part of your health and healing journey, and welcome to the practice.